I think one of the important elements is that it's really engaged general practice as a whole.
Yep.
And in fact, some of the benefits already are GPs engaging in upskilling around urgent care treatments in their practices. But from your perspective, what does it look like? What will this GP urgent care model look like?
Yeah, well, we know from the Sustainable Health Review that there's about 190,000 patients a year that are currently presenting to emergency departments. These are typically your triage 4s and 5s, where we know that the better way for care for them is actually for them to see a GP in an environment which is more appropriate for their illness or their condition or their injury. So if we can actually put them in touch with a GP in their local area, which means they get care quicker, it means they get care in a more appropriate environment. And what it also means is that we take the pressure off our EDs so that they can get to the patients that have more serious injury or illness, and they can get a more appropriate care as well.
Yes, one of the really interesting findings early in this process was the discovery that demand in emergency departments actually relates to the opening hours of general practice.
Yep.
8 a.m. to 8 p.m. And I think for many of the general practices involved, that was a bit of an eye-opener to see that these are actually patients that could be served by them in their community. And I think one of the other sort of great outcomes is the way we've managed to create a solution to a conundrum, strategy, that's about engaging general practice to the betterment of general practice across the board.